Hi, and welcome. I'm Judy Green Scheibel in Sacramento, California, and I'm one of the board members for Metta Calana. We're all happy to see you here tonight and for you to see us. We're going to show you what your generosity has achieved with the Karen people, the women and children. And it's tremendous. It's really tremendous. And along the way, Dr. Terry Smith, one of our board members and kind of our chief, is going to interview Dr. Cynthia Mong, who is the founder and director of the clinic. You're also going to hear from two others who are associated with the clinic and give a different point of view. This is an exciting program that Terry and our crew have put together. And we hope that after you've seen what your generosity has achieved, you'll find it in your hearts and wallets to continue your generosity. If the urge comes to you during the program, you can go to our website and donate. At the end of the program, we'll have other information on donations. If you have questions during the program, please use your chat line on the Zoom program, and we'll do our best to get to them at the end of the program. And right now, it's time for you to hear from Dr. Terry Smith.
Good evening, and thank you for joining us for this virtual presentation. In the past, we've always been able to have in-person events with authentic, delicious food and great conversations. Now, this year, because of the coronavirus, the circumstances made that impossible. So we are trying out a novel approach, and we hope to find this webinar rewarding. I am Dr. Terry Smith, and we started Metta Calana as a way to sustainably improve the lives of women and children in an area of long-term conflict and deprivation. We hope with this presentation to paint a picture of life for women and children on the border and in the villages of Eastern Burma as a way of showing the need as well as the result for our activities. A good place to start is the Metta Clinic. For over 30 years, it has served migrants, displaced persons, and refugees who come to find the healthcare there that is not available to them anywhere else. Metta Clinic is also a key training center for ethnic health workers from all over Eastern Burma who come to learn basic primary care and, in our case, women's reproductive health. For over 20 years, I have trained hundreds of ethnic health workers in basic midwifery skills, who then return to their villages to serve as skilled birth attendants. With your support from Metta Calana, we have been able to buy them medicine and medical equipment to allow them to perform the skill set for which they were trained. So to start off this presentation, let's hear from Dr. Cynthia Mong, who is the founder, the director of Metta Clinic.
I have been working with Burmese refugees and displaced people over the past 30 years. And since the beginning, I work with women and children to protect and promote their basic human rights. And annually, we provide safe delivery for more than 2,500 pregnant women. And we also provide improved access to emergency obstetric care. And many children who are displaced on the border and who were born in Thailand or border region, very difficult or very hard to access legal documents. So we have to protect and promote the child rights, women rights. And while we are working with our ethnic health workers, and the community volunteer. It is very important that the health workers and volunteer and the teacher need to be promote awareness on the child and women protection. That's why we continuously advocate, and then we set up the system to link between the local community organization and government organization to access for health, education, and legal services. Both sides of the border, we train the health workers, and then they need to improve access to healthcare in the internally displaced community. And then they also have to promote women, children rights, working through networking and collaboration among each ethnic organization or civil society organization, or try to link with the government healthcare system. So the building the healthcare system means this is improve health and equity, and as well as the long-term sustainability of our region. Thank you very much.
Cynthia, thank you for joining us and helping us to raise awareness about the situation. You are a person who knows maybe better than anyone what is the situation. The Metta Clinic has been serving displaced and migrant populations on the Thai-Burma border and beyond for more than 30 years. And in that time has become a beacon of hope for people seeking healthcare, and a major training area for hundreds of health workers. So what are the challenges that the clinic faces? And in a larger sense, what are the challenges to providing healthcare for displaced and migrant ethnic populations in Eastern Burma today?
As you may aware that over the 30 years, we have built our partnership with both inside in Eastern Burma and also Thai side. So we are working with the displaced people along the border, also expand into the ethnic state. So since the beginning, Metta Clinic have been training thousands of health workers to improve access to maternal child health care, including basic emergency obstetrics. So we are part of the ethnic health system strengthening group. So this consists of 10 ethnic health organizations. So we have reached more than 600,000 population where there is no other access to the services. So the training of the health workforce is really crucial to reduce maternal death, because only women can access this emergency obstetric and life-saving care. And then gradually we also have building the connection with the higher level hospital, because of the health worker can detect and also can build the referral system. And we continue upgrade our health facility and continue train. So we have been also building the partnership with both Thailand and Myanmar sides. So many women can access both antenatal care, family planning, and emergency obstetric care.
You mentioned emergency obstetric care, and that's something that we are involved with. Can you expand a little bit on what are the benefits of having skilled health workers in the villages being able to recognize problems and manage them early?
As you may aware that on the border, many women are displaced, both inside and in Thailand side. So people are moving back and forth. At the same time, access to antenatal care, family planning, basic emergency obstetric care need to be continued, and also need to make sure that they can access quality services. Because some women can come to antenatal care only one time, but our health worker reach out to the community and have to reach to the safe delivery place for referral system, as well as to be equipped with the skill and to perform this emergency obstetric care when the woman occur life-threatening case. Usually, almost 15 to 20% of the women have been facing emergency obstetric while they are deliver baby.
Wow. Yeah, you know, we reviewed some of the cases that they have seen when they come back for their refresher training. And I am just amazed at how complex the problems are. And yet they are helping with things like preeclampsia, things like infection or bleeding. They have the skills now to be able to advise the patient that they need either to go to the hospital to get care, or maybe they can offer the care right there in the village. It's great.
Yeah, the program we work together with Metta Calana Foundation has been very effective and efficient because our health workers working in different ethnic areas, they have opportunity to meet regularly, to continue upgrade their skill, as well as to understand the local context, especially in the displaced and ethnic area. We have different culture, different political context, but together they can discuss the case, and then they can see how the other people solve the problem, how other organization or other co-workers solve the problem. So they also have opportunity to meet with the supporter and the professional who can motivate and support them regularly. So Metta Calana and Metta Calana Foundation, we are working and closely monitoring their situation, as well as to continue motivate them to work with the complex situation.
That's great. You referenced about family planning, and that is something that we've sort of been involved with. We know that it's a key strategy to help reduce maternal mortality and to allow women the freedom to be able to plan their families together with their husband. And yet it hasn't been easily available in most villages. So one of the things that we support is trying to provide the contraception to all the clinics in Eastern Burma that we can possibly do. Can you tell us from your experience what the impact of having family planning means to some of the women who request it and use it?
Firstly, we would like to say we are success in reducing maternal death through the family planning. Also because like 10 years, 15 years ago, when we see our patient caseload at the Metta Clinic, see almost 30% of the obstetric admission are post-abortion care who come to the clinic with complications. And through outreach program and also training for the health worker, women can access all the family planning methods. They have choice, and then we have connection with other health local volunteers. So the referral system from the community to the Metta Clinic, and Metta Clinic, if we need to do the tubal ligation, also we can set up the referral system. But the health workers on the border now, they are very efficient in providing education, counseling, as well as they have gradually improving more and more technical skill, especially now many ethnic health workers being trained. I think more than 1,000 health workers being trained for implant, long-acting family planning. So women also prefer to use long-acting family planning.
Reversible. Yeah.
So our like the number of the average number of pregnant children in household, or the number of cases who come with post-abortion care significantly reduced.
I can't plan yet when to come to Mesa because of the visa situation, but hopefully in the spring they'll start opening it up a little bit, and then I will come.
Yeah, hope to. see you
Okay.
because here now we don't have much technical person because mostly see during the COVID they have to go back to the country and cannot return to Thailand yet.
Yeah.
So
Yeah. We've done a few Zoom conferences with staff, with Lele and some of the others to talk about some of the protocols in case reviews. So we can do some things, but it's not the same as having somebody there.
Yeah. So you can continue help to do that way because it is very also like motivate them and then learning feel how to learn from Zoom.
Thank you, Dr. Cynthia. Dr. Cynthia is really a key person, a legend really, for women's health. She has won many awards for her lifelong struggle and fight to protect women and children and to promote their health and safety. So we really appreciate her taking the time to do this interview. While it is true that Maytel Clinic serves thousands of people every year and is an important training center, when it comes to actually seeing patients in their actual environment, it is better if we can cross into Burma and go into the villages. That way we can conduct on-site assessment of the needs, as well as conduct on-site training. It takes a little bit of logistics and our work to be able to arrange these trips, but I have been able to get into many of the villages in Eastern Burma since the ceasefire of 2013. And it's always been a very rewarding, eye-opening experience, and one that is greatly appreciated by the people that we serve. This next presentation will feature 3 healthcare clinics in the northern part of Karen State. It is an area of, is an isolated area, and it is very poor. And there are really no other healthcare resources available except for the clinics that we support, hence the critical role for the healthcare workers in the community.
The course will take place in Ituta camp.
Kumono, mobi yo kubanyo kon babat kolwat ko. Na chocolate na ni, no. Okay.
project that we are supporting is one that I personally feel very much attached to. It is the healthcare house, which is a shelter or residence for women and girls living with HIV and AIDS. It is operated by Social Action for Women, whose larger project is an orphanage for more than 100 boys and girls who are orphaned or in some way have lost contact with their parents or guardians. With the support that we receive from Metta Calana, we are able to pay the rent, the utilities, the food, as well as the cost of transportation to medical appointments for about 25 residents of the healthcare house. I have known some of these girls for more than 10 years because they used to come to Metta Clinic for their antiretroviral therapy. These days they can go to a government clinic and get the medicine, but they have really no other means of support and no other place to go. So it is very rewarding for me to be able to see these women grow, be healthy, strong, confident in their future. I would like to introduce you now to the women of the healthcare house.
Over the years, I've had the chance to meet and talk with many of you tuning in tonight. But for those who I haven't met or are checking out Metta Calana for the first time, I'll take this moment to introduce myself. I first met Terry back in 2002 at the Metta Clinic in Mae Sot, Thailand. That was actually the year he first arrived and started working in the border region. After I came back to the States, I wound up relocating to Sacramento in 2006. We reconnected, and it was a few years later that he created Metta Calana and asked me to join. When I was in Thailand, I worked in the pediatric department, helping where I could with direct patient care, program development, and medic training. I also started a nonprofit organization called Burma Children Medical Fund to raise money for life-saving surgery and other high-cost procedures that patients we saw at the clinic but had to turn away. It has now been taken over fully by local staff and has grown by leaps and bounds. I invite you to check out their website, www.burmachildren.org, to find out more about the work that they are doing. For this next segment tonight, I'll be playing an interview I conducted with Dr. Samantha Na in October 2020. She is currently a family practice physician in St. Paul, Minnesota. She was drawn to volunteer work like many of us, out of a mixture of idealism and a search for adventure. Why Myanmar? Her parents immigrated from Myanmar to the United States in the 80s seeking a better life. She was at the Metta Clinic in 2010 and then at the Karen Department of Health and Welfare in 2011 and 12. As you know, a large part of our funding goes to KDHW, helping them to provide women's health services in those remote village clinics we saw in the pictures Terry showed. I have a hard time imagining how different life must be and the everyday hardships that they must endure. While you reflect on those images, we thought you would be interested to learn more about life in that part of Burma, specifically with respect to child health and well-being. Okay. So as you know, this segment is going to focus on children's health and just children's welfare in the border area. So yeah, can you just jump in? Can you tell me what's it like? What's it like for children living in the region?
So just to give you some background, Karen State is home of the longest running civil war in the world. It started in 1949. It's kind of been ongoing since then between the Karen ethnic armed groups and the Burmese military. So, you know, there have been generations of children that have forgone basic human rights, including the right to stable shelter, food, the right to security, right to health and education. So you can really imagine what kind of toll it played on the people there, living there. Many of the children in Karen State live in remote areas, far outside of the big cities where it's very hard to access even with cars or motorbikes sometimes. And so a lot of the remote villages in terms of education have a primary school and maybe a middle school. And so if the family doesn't have enough funds or connections to bring kids out into the cities after primary school, then oftentimes they end up working on the farms or sometimes they even get married early too. In terms of healthcare, really because of the remoteness of a lot of the villages that are there, it's very hard to access healthcare. The big hospitals and clinics are in the big cities, and so a lot of people rely on the local medic who lives in the village or the next village over for their basic needs. Overall, children have had to overcome a lot of adversity to get even the basic education and healthcare and just their basic needs met. And so a lot of the organizations along the Thai-Burma border have done quite a lot to help address this, but the need is still pretty big right now. And for those parents and families that fled because of the war, a lot of them ended up in refugee camps, and children a lot of times are born in refugee camps, stay in refugee camps their whole lives. There's 30-year-olds out there that have never seen the outside world too. So it's caused quite a lot of chaos and instability in a lot of the lives of children.
What would you describe are the major health and public health problems, particularly to do with in the pediatric age range?
Yeah, so when I think of peds, the first thing is healthy moms, because healthy moms and healthy pregnancies, and so the maternal mortality rate in that part of Karen State as compared to Burma is significantly higher. Like there's estimates that it was 10 times higher in 2008. So it was a big area that we needed to address, and a lot of the local health organizations have worked on that quite a lot, including Metta Calana too. Other than that, infectious disease continues to be pretty big. So things like malaria, lower respiratory diseases, diarrheal diseases significantly contribute to infant and child mortality. And then, there's that lifelong malnutrition that comes with food scarcity because, a lot of people are displaced too. So those are pretty much the biggest health issues. And the other thing I haven't mentioned here is mental health, just from human rights abuses and displacement, essentially. So a lot of the groups that are working on the border have really worked on addressing these things. So, things have gotten a little bit better, but, we only have a ceasefire now. We don't have kind of long-lasting peace yet. And so a lot of these things still need to be better addressed or more systematically addressed.
Actually, you mentioned mental health issue. Is there access to psychiatric care?
Yeah, I think it's vastly unknown what mental health is. I think, it's something that some of us in the US sometimes don't even accept too. So it was not even a program of a lot of the health, or a priority of a lot of the health organizations that were there. But, in the past, I would say 10 years or so, it's become more and more of a priority because of all the human rights abuses and the traumas that people have experienced throughout their life, starting from when they were kids.
Okay. So a lot of our funding from Metta Calana goes towards the organization called KDHW. Let's just talk about them and specifically what they do for promoting children's health.
Yeah, KDHW is a community-based, what they call an ethnic health organization that was previously based in Thailand, but they have since moved or have a base in Karen State now. So it provides public health and also basic primary care services to the vast majority of the remote parts of Karen State. So parts of Karen State that are not accessible by government health programs, essentially. It's community-based in that all of its staff members, health workers are all from the local area. And, they try to encourage people from even specific villages to work in their own village as a part of this organization. So no one is a foreigner or anything up all the way until the leadership. And so just to give you a sense of what they do, so they have a number of disease-based programs. So they have, and this is more on the public health side, so they have a malaria program, a TB program, but then they also have kind of primary care base. So they have what they call village tract health centers that are throughout Karen State, and usually kind of covering a few villages at a time, where they have a health worker there doing some basic primary care.
Let's say KDHW wasn't there. Does the Burmese government have anything? Is it overlapping programs with the Burmese government, or would this area just be without, I guess?
Yeah, that's a really great question. I think it's very relevant to today and kind of the changing politics after the change to a democratic government and everything. So in the past, those remote areas of Karen State were all what they call the black zone, and so they were areas of active conflict. And so it would have been near impossible for government workers to get into the areas that, like in the remote areas, because one, the people did not trust the government because they were actively committing human rights abuses against them, and two, it was just really hard to get into because those areas were not controlled by the Burmese military. So I think KDHW and other organizations have really stepped in and made a huge difference in these people's lives where no one else could have gotten to them.
Thanks, Dr. Sam, for your insights. The situation in Karen State is certainly complex, but you have summed up the impact of the conflict on generations of young people and put into context the need for Metta Calana's activities. Next, I would like to introduce Dr. Min Min Tha, another of our board members. She grew up in Burma, and her family members in Yangon today are active in the National League for Democracy, which is Aung San Suu Kyi's party, fighting for democratic reform. As an economist, she is a keen observer of the economic situation in Myanmar, so we are fortunate to have her as a member of our team.
Hi, my name is Min Min Thaw, and I was born and raised in Burma. And I have been here in the United States for the last 30 years. And I'm a board member of Metta Calana for the last 7 years. And when I was asked by the Dr. Terry to be a part of Metta Calana, I was very, very thrilled. And I was very happy because I knew that Metta Calana has been helping the women and children of Burma for the last so many years. And I'm so proud to be a part of this wonderful organization that helps the ethnic minorities who live in the northeast side of Burma. So I would like to take this opportunity and thank all of you for your continued support. And if this is your first time, welcome to the Metta Calana. And if you have been helping us for the last so many years, I would like to say aloha, thank you, and in Burmese will be Jesu Tamade, and we expect you to have continued support, and thank you.
We hope this presentation raises awareness of the needs of a population that has suffered generations of poverty, displacement, and lack of critical health care. Metta Calana's approach has always been to enable and strengthen local community organizations such as the Maytel Clinic, the Social Action for Women, and the Karen Department of Health and Welfare to be able to better tackle these issues within their own communities. Metta is a Buddhist term that means compassion, and that has always been our guiding spirit. For those of you who have supported us over these years, we are really grateful and hope to have your continued support. For those of you who have not, we invite you to join our rewarding endeavor. And thank you to everyone. Thank you.